Last week, the Ministry of Health presented to the committee a supplementary budget of 31.9 billion shillings to cater for 5 items whose priorities included wages and inspection of specialized Luwa Hospital, among others. The denounced budget, however, had to be reset and have Mulago Hospital as a clear priority. Today, the State Minister for Health, Honorable Hanifa Kawoya, presented a 50 billion shillings quotation for the completion of the country's referral hospital.
Honorable Chair, it is therefore my prayer as the lead of this sector that government considers supplementary. The reason we are here to put our case before you, Chair, and members of this committee, that we are in a requirement of 15,480,950,244,000 only to enable this ministry pay for completion of works and the consultancy, and we see that the project goes on.
Members of the committee were, however, displeased with the request, terming it unacceptable as its presentation looked unofficial and non-committal.
When you look at the presentation that has been made by the minister, it's totally unacceptable. There is no letterhead on this document, and this is a request for 15 billion shillings as a supplementary. It is not on a letterhead. Request for supplementary. It is Mulago, which is the one being supervised, is decent enough to ensure it's on a letterhead.
According to the legislators, the country's National Referral Hospital is in dire state despite chunks of money appropriated for works, offering no progress in almost 10 years.
Million Ugandans. But there's that person in Amol who comes all the way for an MRI scan. He has gone to Gulu. Gulu refers him to Kampala, and he comes. He doesn't know these things of a consultant. He doesn't know these things of variations and so forth. What the 40 finished product. But right now what we are seeing in Mulago is people come in and you're referred outside to get an MRI scan, a CT scan, and then you come back in. That is absolute madness in terms of planning. And you understand. Now for us, the health committee, the government takes a beating. A loan was procured, and that's what the voter knows, because this is taxpayers' money. They don't know all these things that rock or run into a brick wall and so forth. We want a finished product.
Go Hospital is the face of Uganda's healthcare system, and it has been disfigured since 2014, undergoing reconstruction surgery with no timelines when it will get out of the theater. When I listen to all the presentations that have been made, what is very clear here is that the Ministry of Health is suffering from an outbreak of poor planning and a pandemic of weak supervision.
On the other hand, the chairperson of Roko Construction Limited told the committee that it is true they were challenged in the past, especially during the COVID-19, but they have now resumed works and await government's consultancy.
They've been having the challenges since 2020. So I think, Mr. Chairman, we shouldn't forget that in terms of the past, I think we elaborated in Parliament and with different ministries about what the challenges were. They were also presented to Parliament.
Samlanifa, Smart 24 TV, Business Today.